Did you know that hepatitis can sometimes affect your liver without causing any obvious symptoms at all? Hi legend, welcome back to Joy's Health Secret. So in part 1 we talked about hepatitis and the things that causes hepatitis. But here is something very important. How do you know that hepatitis is affecting your body? The tricky part is that hepatitis doesn't always announce itself immediately. Some people have little or no symptoms, especially in the early stages. When symptoms do appear, your body may give you some warning signs. So let's look at them. Number 1 symptom is extreme tiredness. One of the usual symptoms you will notice is tiredness. You may feel weak, exhausted, or lacking energy even when you have not done anything. Now, being tired once in a while is a normal thing, but being unusually tired even when you have not done anything physically demanding is not normal. But if you are constantly exhausted and it doesn't seem to improve with enough rest, then it is worth talking to a doctor about, especially if you have these symptoms on the list. The second sign is loss of appetite, nausea, and vomiting. Another warning sign is the way you feel when you eat. You may suddenly lose your appetite, feel nauseous, or sometimes vomit. You may also notice discomfort, sometimes in the upper right side of your abdomen, where the liver is located. Imagine normally enjoying your meals and suddenly you don't even feel like eating. That change shouldn't simply be ignored if it continues. The third one is flu-like symptoms. Some people with acute hepatitis often experience symptoms that looks like an ordinary infection. You may have fever, headaches, muscle or joint aches, or simply you feel generally unwell. And this is one reason hepatitis can be very difficult to recognize, because you might think, oh, it's just malaria or normal viral infection. But if the symptoms persist or other warning signs appear, getting medically evaluated is important. The fourth one is yellowish eye or skin. Now, here is one of the most recognizable warning signs. Yellowish of the eyes or skin. This is called jaundice. Your liver normally helps process a yellowish substance which is called bilirubin. When the liver is not functioning properly, bilirubin can build up in your blood and cause the skin or whites of the eyes to turn yellow. If you suddenly notice that the whites of your eyes are becoming yellow, don't just assume it's normal, get checked. Next one is dark urine and pale stool. Your bathroom habits can also provide clues. Urine may become unusually dark, while your stool may become unusually pale. Now, why is it like that? That is because liver inflammation can interfere with the normal processing of fluid and movement of bile. People may experience itchy skin or abdominal pain. And the good news is that these symptoms can happen for different reasons, and it does not automatically mean you have hepatitis. That is a very important thing to know, because symptoms alone cannot diagnose hepatitis. You need to see the doctor. Most important thing to know, here is the part I really want you to remember. You can have hepatitis and still have no any warning signs at all. Some people don't notice symptoms until the infection has been present for some time. That's why testing can be so important, particularly if you have had certain exposures, or if your healthcare professional recommends you to go for screenings. And if you develop yellow eyes or skin, severe abdominal pain, persistent vomiting, confusion, or any other symptoms, please go get checked by a professional. Your liver does a lot of work for your body, so please don't wait until you fall sick before paying attention to it. And if you learned something from this video, share it to someone who needs to hear it. And don't forget to follow or subscribe for more health secrets. And I'll see you in the next video.